Welcome to the Wellness and Recovery webinar series, Office Hours. My name is Meg Beyer, and I work for the Managed Care Technical Assistance Center at the McSilver Institute at NYU. I'm going to be starting us off today, and shortly we'll hear from our wonderful panelists and presenters who are joining me. So again, just to get us all started, I'd like to invite you to send in any questions that you might have via the chat box, and we'll respond to the questions that way. Feel free to send in as many questions as you have. We have a whole hour dedicated to office hours, and we hope to get to as many questions as we can this morning. So with that, I just want to, again, welcome everyone and remind you of a few housekeeping things before we get started. So again, the chat box on the right-hand side of the WebEx will be how you send in your questions. This webinar is being recorded today, and it will be posted to the CTAC and MCTAC websites. I also wanted to put this slide up on the screen just to kind of also get us started. Should you have any outstanding questions after the webinar series wraps up today with the office hours, these are some contact email addresses that you can reach out to for additional technical assistance and question support. At the bottom of the list, we have the CTAC website where these recordings and other resources can be found. We also have the OMH Managed Care mailbox, the OMH HCBS application, the OASIS PICM mailbox, and the Managed Care Technical Assistance Center email address. So we hope that these email addresses are helpful. Should you have any questions, do feel free to send them. All right, and with that, I'm going to open it up to my fellow presenters who will introduce themselves, and then one of our presenters will talk through a little bit of our roadmap, a description of our roadmap technical assistance collaborative before we start to dive into the questions. So with that, I'll pass it along to my colleagues who will introduce themselves.
So, hi everyone,
good morning.
This is Edie Schwartz. Oh, we're all waiting for each other to introduce ourselves. I think that's the problem. Why don't, you know what, I'm Edie Schwartz. I'm from the New York Association of Psychiatric Rehab Services. And Marcus, why don't you introduce yourself first? How's that?
Sure, Edie.
That way we won't step on each
Hey,
other.
everyone. My name is Marcus Doherty, and I'm from the National Center on Addiction and Substance Abuse, the MCTAC team. And welcome to Office Hours.
Great. Andrea?
Good morning. This is Andrea Cole, and I am an implementation specialist from the Center for Practice Innovations.
And
good morning,
Sapana?
everyone. This is Sapana. Thank you, Edie. This is Sapana Patel from the Center for Practice Innovations. We're so glad you all can join us this morning for office hours.
Great. And Morgan, are you still with us hosting for us?
Hi, it's actually Jocelyn. I'm Morgan today from CCSI and the MCTAC team.
Hi, Jocelyn. Thank you. I knew that, and somehow I keep seeing Morgan's name and messed that up. So welcome. Is anyone else on our team on the phone that I'm not seeing? All right, so again, I'm Edie Schwartz, and I work for NIAPRS, and at NIAPRS, I oversee our Systems Transformation Division, which is our education and training, and along with my great partners from the mental health and substance use side, we have worked really hard to try to get to the heart of the issues of recovery and wellness that we all need in order to move forward with providing really top-level services and top-level HCBS services. When we sat down to work through what kind of training folks might best use in their practice, we realized that without this very basic understanding of what has to shift to really provide recovery-oriented services, that we would be unable to follow through with the kinds of service provision that HCBS outlines and the kind of service provision that our state directors really have been helping us to move towards for really a couple of decades now, and that is towards wellness and recovery-based services. And I guess, you know, and while I'm talking, by the way, chat away. Do ask your questions. We are here this time not to give you a bunch of slides, but to have a conversation. And the good thing about office hours is there's a smaller number of people on. We don't have 800 people on the telephone here, so we can have a good give and take. And we want to make this as conversational as we can with the muting that goes on, knowing that it is, you know, a telephone call. But one of the things that is really difficult when you're providing services is to really understand how wellness and recovery changes what we do, what we think of, how we interact with people, and the way that we provide those services. And oftentimes, we don't realize it because we're all in this to be engaging, to believe in recovery. I mean, who doesn't believe in recovery? Who doesn't believe in wellness? We all do. But we're not really taught this in school in such a clear way. And so sometimes we put up some barriers in ways that we don't even see. And what we've been trying to get at in our trainings is just to make us all aware of those barriers and to knock them down so that we can provide the kind of services that we really want. So while you're typing in your questions, let me also ask you a question to type in some answers to. And let me also say that everyone on this telephone has gone through what I call an aha experience, where we have realized that maybe what we were doing wasn't as recovery-oriented as it could have been. And we've all had that experience, and that it's a constant journey to move past it. It's not that we've moved past it. We're all sort of recovering traditional practitioners and trying our best to really integrate recovery and wellness into everything we do and everything we create. So there are no foolish questions. There's nothing ever to be embarrassed about. Please share. We'll share with you what we've done, and hopefully we'll have a really good hour, a good cathartic hour where we can have our own aha experiences and then move forward with providing the kind of services that we know people need in order to reach and maintain recovery. So let me ask you, in these 4 sessions that we've provided, the overview of what recovery is, how to develop a recovery relationship, what services look like when they're recovery-oriented, and how your organization might look if it was recovery-oriented. In any of those, did any of you have that aha experience? Did any of you come upon something, no matter how small it is, where you said, oh my goodness, I believe in that, but I'm not really doing that, or my agency doesn't look like that, or this last interaction I had with someone wasn't quite like that. So type in your questions other than this one, but type in some answers to this question. And let me know if you've experienced that at all and what it was like. I'll give you a minute to type. Jocelyn, Meg, do we have anything coming in or anything else?
So far, we don't have any questions that have come in right now, but we are eagerly awaiting some of these. Just want to remind everyone that we did set up this webinar as an opportunity to kind of work through any issues or questions that might have come up from our previously posted and recorded webinars. So if any questions have come up at all, remember there's no bad question. We have a whole team of experts with us on the line right now. And we're happy to kind of talk through and work through some of the questions or concerns that might have popped up. So do chat in
while
your
you're
questions.
thinking,
Yep.
Sorry, Meg.
Go for it. Go for it, yep.
So while you guys are chatting in your questions and thinking about it, how about my fellow panelists? Is there anything that you can share about a time in your practice or a place that you worked or something you've thought of or some interaction you had with someone where you realized that you could have done it a different way, or where you did do it the right way and had a great outcome? Is there anything that you can share from your personal experience for folks to get the ball kicked off here?
Hi, Edie. This is Sapana. So while you were talking, it occurred to me that one of the topics that we covered that I think is so important in a person's recovery journey is the idea of including family members or supports within a person's community, and taking the time to understand what recovery may look like, that really can be defined more by the person as opposed to what we as practitioners sometimes think are the only options available for recovery. So I for example, as a clinician, very early on in my training, was taught about how it's important to let a person know about the services and the treatments that are available. And I had a moment, that aha moment that you're talking about, when I sat down with a person who, had immigrated to this country and didn't really have much of a community or a family presence here, but was struggling in their lives. And there came a moment where, in sitting and talking and telling this person about all the treatments that are available in this clinic and how we may be helpful, it occurred to me that this person really didn't have much of an idea of what I was talking about or what these services entailed. And so there was a matter of educating them, but I think there was a moment where there was a pause and a need to really check in with what the person's understanding was of what they were going through, and also, what kinds of things they identified with that might be helpful in their, working through their struggles. So I think my aha moment, that if I can sort of share, would be that recovery and how it's defined is not solely based on what you as a practitioner or a clinician may be able to offer in terms of services, but goes rather beyond that to what the person that you're sitting with may feel is part of what might be helpful to them. And crafting their plan using their words in some ways as well. So I just wanted to share that because I thought it was something we touched on in our webinar series and important to person-centeredness too. So.
Absolutely, I totally agree with you. And that's a piece, like I was saying before, that sounds so easy, and it's not easy. Because somehow we especially I'm a social worker, and you're a psychologist, Sapana, right?
Yeah. Yep.
Yeah, and we're not trained in school to actually listen that the person we're working with is the captain of their ship. We're kind of trained in a way to be respectful, but that we know something. We went to school and we learned something. And so I think it's very hard for us to unlearn that and to move over into realizing that that the person you're working with probably knows best about what works for them. And I agree with you. Those are really important issues. And I think the other important issue you really brought up is we talk so much about siloed services, but we're siloed as workers. We don't include family all the time. We don't include other support folks in our service provision, people who are important to the person who's on the recovery journey. So I think those silos, they trickle down all over the place.
They do. It's very true. It's very true.
Anyone else on our panel?
Sure. This is Marcus speaking. I would have to totally agree with you, Sapana, and you, Edie. In my career, my aha moment came as an early clinician when I was working with clients, and I had to come to realize that the work that we do with clients is really client-driven. It's not program-driven. It's not driven by any other mechanism other than where the client is at. So as a young clinician, very often we tend to really want to direct and want to kind of tell clients what to do as opposed to actually listening to where the client is at and kind of understanding what the client's struggle is and helping to facilitate movement through where the client is at. So I think you're right. I think in school we're taught a lot about theory, but we're really not really taught really just how just to be quiet and to listen and to kind of empathize and kind of feel where the client is at and kind of work our treatment around where the client is at and let the client really drive it. So I think that that's a really key concept that sometimes it takes a while to really understand. And once you understand it, to be able to put it into practice. I always say, for example, when you're working with clients, you know, there's really two experts in the room. There's you and there's a client. The client is an expert on his or her experience, and you may be the expert in terms of content and in terms of knowledge you might acquire in school, but it's really a collaboration. It's really you listening to where the client is at, and then with the client's input and with the client being empowered, really working with the client in that direction. So that's the part that I think only comes through experience and with time to really work with clients in a person-centered way and in a recovery-oriented way.
Yeah, I appreciate everyone's insights. This is Andrea, and I was thinking a little bit about this idea of education and kind of being socialized into the profession, and I think that it's not just what we learn when we're going to school for our respective areas, but there's also kind of a sense that's put out in the media, sort of a lifetime of learning about what what the power differential can look like between a provider and, say, the folks that come to services. And that, it's an unlearning for us, I think, but it's also sometimes an unlearning for the folks that we serve that, hey, like, you do have power in this relationship, and we would love, for you to be able to express some of the needs or wants that you would like to get out of our work together. And I've had a number of aha moments, I think, in this process, but I was also thinking a lot about changing agency culture kind of across the board and how long that can take and how arduous it can be sometimes. And when I first started practicing as a social worker, one of my roles was to help engage clients in their intake, their first meeting with a worker. And the agency that I was working at only offered appointments for that first appointment at 8:30 a.m. in the morning. And there on out, the other appointments were never really offered in the evenings, which I think, at the time I was sort of a line worker. I didn't have necessarily a lot of space to kind of to maybe push back against that a little bit, but I did think a lot about the fact that, hey, like in a recovery-oriented approach where we are hoping that people can, if they choose to, say, work, and that's a goal that they have, that it would be really hard to work and also go to intakes that are only at 8:30 in the morning possibly, or never have an appointment in the evening. So I just think, it takes time for everybody to make these adjustments, but I do think, we'll get there.
Absolutely. Thank you, Andrea. This is Edie again. I just want to say to you, to the participants, that we really are happy to chat among ourselves, but we really want to chat with you. And none of you are answering my questions, so I'm going to ask you another one. And I'm hoping that someone is going to share And if not, we'll share another round with you, but we would love to hear from you as well. So, I ask you out there, you've watched or listened to one or all of our webinars. Is there one thing, just one, even no matter how small it is, that you changed after listening to our webinar? Is there anything that you thought of doing differently, or that you realized that you needed to share with someone else and do something different? And put that in the chat box and let's share it a little. I'll give you an example, a really simple example, a kind of funny example. Before coming to NIAPRIS, I was the CEO of Putnam Family and Community Services, which was a small behavioral health agency in Putnam County, New York. And I actually started it practically from scratch. It had been a sort of loose confederation of government services that privatized and became a nonprofit. So it was really its first day. I was the first executive director there. So it was fun, and we built it from scratch, and we built a nice recovery-oriented agency. But about 7 or 8 years in, I walk in the front door, and it hits me. I see no smoking 30 feet from the building. Please pay, when services are rendered. Don't speak loudly, don't this, don't that. There were all these signs, and there wasn't one sign anywhere that said welcome. There were words of recovery on the wall. If you remember that, program one where we talked about what does a program look like, there were recovery stories on the wall, and there were children's art on the wall about what health and wellness is. But there were all these don't signs. And what I realized was when you open the door, you want somebody to say, hi, I'm so glad you're here. And so we got a big welcome sign, and we put it right opposite the front door so that people would walk in and they would immediately see welcome before they saw don't do this and don't do that. So that was sort of a moment for me of something I learned from actually listening to somebody in like a webinar like we did. So that was a change for me. How about for you guys? Did you change anything, small or big, out there? Or any of our panelists? You guys going to make us dance around for an hour? Come on now. You all have to share. Jocelyn is asking you to chat us in your thoughts in the chat box, and we're asking as well. Anyone else on the panel have anything that they looked around and saw somewhere in their life and said, oh my goodness, I need to make a little change here?
Well, one of my experiences, Edie, was very similar to yours. And I worked in an outpatient setting, and my first thought of coming into my center was the person that people have the first contact with very often is the receptionist. So I would look at how the receptionist interacted with people coming in for the very first time. And what I found was that really the first contact or the first impression is extremely important. Whether that person is welcoming, whether they greet you warmly, whether they know your name as opposed to just ask you for a slip of paper. If they don't keep you long in terms of appointment times, those things are really important because they make people feel welcoming. So just looking at those things I thought were very important to implement and then to be consistent about. And the question that I always asked myself was, if I went to a clinic or went to a doctor's office or went anywhere, would I want to come back based on how I was treated the first time? So I think that that's very important, and I think that that's also recovery-focused and person-centered because recovery work and person-centered work is really about the person. It's about embracing the person and assisting that person. So I think that that's very critical as well.
Absolutely.
Yeah, and a lot of my practice experience is in mobile crisis, which involves a lot of home visits. And so as I started to get more experience as a practitioner, when I first started, I would kind of, it wasn't always like super friendly at the door when people would answer, and I was, kind of maybe not using the best methods to, encourage them to meet with me. But over time, and as I started to take on a more recovery-oriented lens, I really just constantly tried to put power back into their hands. So I would explain exactly who I was, and I would say, would you prefer to meet outside? Would you prefer to meet in your home? Who would you like to be present for this meeting? Is there anyone else here, who you'd like to invite so we can all chat together? Just being really clear about, who I was and my role, provide them with my business card and explain exactly when they could reach me. Just trying to really explain the process and be really inclusive and, putting as much sort of knowledge and power back into their hands. Because in this, in this case in mobile crisis, I'm showing up oftentimes kind of unannounced in a surprising way. So my practice definitely changed over time as I started to take on a more recovery-oriented lens. And then as we would discuss, options for whether they wanted to go to treatment or not, I'd always say, this is totally up to you. This is your choice. You have rights. You can decide if you want to continue, with a provider or not.
Absolutely, I agree totally. When I ran Putnam Family, we did substance use as well as mental health services, and the woman who ran my addiction services used to say that people need to be given choice. Even people who are mandated have choices. They can choose treatment. They can choose a jail. They can choose, which way their life is going to go. And I think that we forget that sometimes, especially like you, Andrea. I spent a lot of years in the Westchester crisis team, and when you do crisis work, you see people right at the time when they really are not feeling their best, and when you take more power from them at that time, it doesn't make them better. It makes them worse. Yeah. So being able to get some control and power back when you are feeling so powerless is one of the first steps towards recovery.
Great. So I just wanted to let our presenter panelist team know that we did get a response to Edie's last question in terms of if there's anything. Yeah. So just to let you know, I think, Edie, your question had been, is there anything that you noticed after listening to our webinars within your organization, your practice, your agency, that you thought about differently after listening to our webinars? And so one of our attendees responded, they noticed that they started to realize that there were areas within their organization that were labeled as staff only, so exclusively staff areas such as the restrooms, and how to work on opening that to all of the individuals they serve and work with.
That is such an excellent point. Does anyone want to address that?
Well, so this is Sapana. So I just think it's so important to create that safe space and a level playing field among, all the individuals that are part of any kind of organization, and that, people really be seen as, just provide that there's no silo, really, as you were pointing to before, Edie. This is just another example of a silo that really kind of draws a line between, the folks that are receiving services and the folks that are there to help and provide services. And I think that it's so important for there to be that level playing field for people, anyone in the organization, to be able to use any restroom. It's part of that welcome sign, I think, that is really important.
Yeah, this is such a big, it's interesting because things like restrooms are, when I go in and do training and I say to folks, you need to get that sign down, that staff only sign down. That is the biggest issue that people have. Even people who are totally recovery-oriented and person-centered in their practice, they still want to have a separate space. And I think that's one of the things. There's a lot of reasons why, and I'm not putting it down. I'm just saying it's one of the things that we need to explore about there are consequences for some of the things that make us feel safe as workers. And, sometimes having a locked front door makes us feel safe. But the question is, what does that do to the person on the other side of the locked door? And how, you have to weigh your need to feel safe against the feeling of the person on the other side of the door. And again, there are other ways. I'm not saying not to be safe. I like Andrea, I worked crisis a good portion of my life and went into places that were somewhat, volatile. So I'm not saying that we should throw reason out the window, but we do have to remember that there is someone on the other side. And one of the things that I do a lot, and I don't know if any of you do it, but I have a chronic health condition, so I'm at the doctor a lot. And I think about, how would Edie feel if I walked in and somebody, and I go to a very small doctor where everybody knows everyone and they're called by their first name, and I call the doctor by her first name. And that's rare these days, but it's very special to me to be able to make decisions with her about my health care on an equal basis. And I think when I set up my agency, I thought, how can I make this as equal as possible? How would I feel if I were standing on the other side? How about you guys out there, participants? We're not losing any of our participants. You're all staying on the phone, but you're not asking us questions or sharing information. So I'm curious if you want us to continue to chat, or or if you want to ask us some questions and make some comments, because I know you're on the front lines. I mean, I have been off of the front lines for quite a while. You're on the front lines now, and you know how you are providing these services and what people are asking of you to help them on their recovery journey. And we would so love for you to share with us some of the things you're learning and share with each other. Anything else from my fellow panelists? Any questions? Because if not, I think maybe we should call it a day if we don't have questions, and we don't have questions to give to the panel. Anyone else on the panel have any questions for the audience that they might answer? That one single person who answered, thank you. That was a great comment. Go ahead, Marcus.
Yeah, it's more of a comment and an observation as opposed to a question. I would just like to comment on recovery and just mention that, it's really a process. It's really a way of thinking. It's not something that's kind of neatly bound together in a book or a textbook. It's really a philosophy and a way of thinking in terms of how we work with our clients. Sometimes it could be very much the simple things like how do you address your clients? Do you call your clients by their first name? Do you address them Mr. or Mrs., or do you ask them how they would like to be addressed? Sometimes it can be attempted to normalize things as much as possible. Sometimes you get as much information walking with a client to the store, for example, as opposed to sitting behind a desk. So it's really about normalizing as much as possible with clients, and then making clients feel that we're people. Okay, so we're folks that have a certain amount of information and a couple amount of knowledge, but at the end of the day, it's always about connection and normalizing as much as possible. So just to kind of summarize it, recovery and person-centered work is really a way of life and a way of professional life. So I would just like to add that, Edie.
Absolutely. That's really well said. And, you know, I'd like to add also that, you know, I've been a manager and administrator and a leader for a very long time. I haven't actually been a practitioner for way too many years. But it's the same skill set, and recovery works the same way. So, you know, when you are, if any of you out there are in positions where you're directing services or directing agencies, you have the ability to be able to think in a person-centered and culturally competent way when you set up your agency. You know, one of the first things we did at my agency was change the intake, because, you know, what happens when you go to an intake? You know, let's face it, what are the questions? How many hospitalizations you had? When was the last time that you used? You know, what are your medical conditions? You know, what medications do you take? When was the last time you took them? And, you know, it's too much. And so our first question was, welcome. We're so happy to have you here and that you chose to come here to work on whatever issues you're feeling. Let me know how I can help you. What can I do here to help you get on top of life? Those were the first questions. And some people cried right there because no one had ever said that to them. And, you know, it's almost, again, you know, like I'm about to go into my doctor's office next week and say, I'm taking a big trip at the end of June, and I want you to be, whatever you do, I want to be healthy for those 3 weeks. So let's work together so that I don't get symptomatic while I'm gone. And that, you know, those are the kinds of things that we want to be able to do in providing services is, you know, are you, things that you've all experienced, things like clients saying, I want to get a job so I can't be sleepy during the day, and then people changing medication regimens so that they're not sleepy during the day. You know, people saying, you know, I really want to date, or I really want to have a baby, and making changes in the way that we might do things service-wise so that people can have that life where they can go out and find a mate or have a child and be healthy while doing it. And it's a way of changing what we do. And it's so subtle, but it's not the normal way. And I think we just need to put on the table that everyone isn't out there doing it that way, but in order to really move towards a wellness and recovery practice, that is what we have to do. And while I'm saying that, let me also tell you that that we will be coming around to a town near you in person to do the next, I think June and July, to do the next section of our Wellness and Recovery series, which is really going to talk a little bit more about changing practice and moving forward. Do I see that something has been typed in, Meg?
Yeah, you do. So we've actually received some comments, and I think they're from the same person who responded earlier, so thank you, our commenter extraordinaire. And really this was just this participant sharing that they really appreciate what we just shared and agree that they always try to put the individual's feelings and response to a situation first, and that this individual would really want them to feel safe and comfortable in the services that they're receiving. Wow, that's wonderful. Additionally, this person also agrees with what Marcus shared, that it's so essential to make them feel in control in the navigation of their recovery. Well said. So thank you for sharing that. No questions, but just, I guess, if anything, thanking us and our presenters for sharing their experiences. And so, as Edie said, we will be having some in-person offerings in June and July where our presenters will be up in front of the room talking through some more of the elements of recovery and wellness and practice change. So you'll have more of an opportunity to ask questions in person. We hope you can attend. We haven't announced these dates yet, but they will be announced shortly. So if you have not signed up for the MCTAC listserv, we would encourage you to do so. That's how we automatically update everyone on any of our future offerings or trainings. And I really want to thank all of our panelists, presenters who shared their experiences today, and as well as our participants who joined and chatted in questions. So with that, I think we're all set on my end. I want to turn it over to my panelists and fellow presenters to see if there's anything else you might want to share.
This is Edie again. I would just share this with you guys who are still on the phone, and actually you're all still on the phone. This has been a long time for me. I've been around a long time, and I first had my aha moment in the late 80s when I heard William Anthony from the Center for Psychiatric Rehabilitation at Boston University and Pat Deegan, who is an incredible advocate and speaker on behavioral health issues and a consumer advocate and speaker. And they stood up on a stage when it was not in vogue to say these things, and they said this simplest thing. They said, and this was really at that time really around people with psychiatric disabilities, but it goes for everyone. It goes for people with substance use issues as well. And they said people with psychiatric disabilities want and deserve the same things in life that everyone else does. Now, how simple is that comment, right? But what it said to me was, oh my God, what am I doing? What am I looking at? What are the things that are most important? You know, do people want another psychotherapy group? Do they want another pill? You know, do they want another day program? No. They want a job and a good place to live and help in times of crisis and a relationship and a family and love and caring and fun, what we all want. And I think that that's so common and so, like, it seems so easy, but it is not so easy to do. So what I'd like to leave you with is the understanding that this is something as workers that we all struggle with, is how to really provide wellness and recovery-oriented services that are person-centered and culturally competent. And we don't ever want to give up that struggle. We want to keep everything we do, we want to keep moving towards that. So I ask you to go back and look at those slides again with that thought in mind and really look hard at what we do, because it isn't going to happen overnight. It's a constant movement towards working in a different way, and it's incredibly gratifying because people really get better and people join you in their recovery movement. And the most special thing is that you get to join other people in their recovery journey, and that's what all of you do every day. So you know what I'm talking about. And I just want to thank you for doing that and for listening.
All right. Well, thank you, Edie. We had one more comment chatted in. That one other, and thank you for another participant sending in your thoughts and suggestions. So one participant actually shared that one thing they've changed and had several clients share that they really appreciated was the intake process. They made it more personalized and personable, and they've received direct feedback from their individual clients that they really appreciated that. So thanks for sharing that. Starting, with intakes, that's the first interaction and point of contact. It's really important to establish the foundation of wellness and recovery at the onset. So that's great. Thank you for sharing. So again, thank you for joining us this morning. Thanks to our wonderful panelists and participants. Stay tuned for more offerings, and we want to thank you for joining us this morning. So take care. Thanks a lot for joining.
Thanks, everybody.
Thank you.
Thank you.
Thank you.